I think, speaking for myself and probably speaking for other clinicians, I don't think that we decide who to take on based on what kind of insurance they have. I do know that on November the 5th, the Centers for Medicare and Medicaid Services submitted a letter to all the state-run Medicaid programs that indicated that the restrictions that have currently been in place may not be consistent with the spirit of the Social Security Act that created Medicaid. And I know that on the same date, the CMS submitted letters to the pharmaceutical manufacturers urging them to engage in ways to reduce the or increase the affordability and reduce the barriers to care. This isn't the first time that the healthcare system has been faced with new drugs that have threatened to overwhelm the healthcare budget. I mean, certainly we remember from the late 1990s when new antiretroviral drugs had come out. As an infectious disease clinician, I remember this quite well, that when these drugs came out, highly potent, highly active antiretrovirals that were highly costly, major concerns came out around how can we afford these for patients. But at that point in time, all of the key stakeholders came together and were able to address this issue and remove the barriers to care and limit and increase access to these life-saving drugs. So I think the time is now to bring together those stakeholders again to remove these restrictions and get more patients treated. And I think that the letters that the Centers for Medicare and Medicaid Services sent out are an important initial step towards getting those stakeholders together and reducing those restrictions. I think that if you want to move forward with changing policy, you have to have empiric evidence that the restrictions that are currently in place are actually affecting the patients who are getting the drugs. And why I think this is an important paper is because this is really the first empiric evidence that confirms the concerns that the restrictions that are currently being placed are adversely affecting the receipt of these drugs for patients. My hope is that after this paper is published, that policymakers can point to it as evidence to amend the current system. These current antiviral drugs are highly efficacious, highly tolerable. Many of them are once daily, all oral. They are the best current option we have. And so I think that it really behooves the policymakers at this point to come together to try to remove the restrictions that are in place. One of the things that we found in regards to the number of appeals that were submitted were significantly lower for patients patients who were covered by Medicaid. And I would have thought that for a program that has more restrictions, that more appeals would have been filed. But the number of appeals was significantly lower that were submitted compared to those who had Medicare and commercial insurance. I suspect that what may have happened is that faced with such severe restrictions, providers simply may have given up and not decided to submit appeals. Well, I think it's a matter of trying to change the restrictions so that providers don't have to go through the appeals process. The current system is so laborious now, requiring completion of paperwork for prior authorization, submission of these paperwork to the insurers, denials that require response with appeals, that it takes away from the time that providers have with their patients. So I actually think that trying to make the process more simple, and particularly, one of the other aspects of our study is we looked at the reasons for denial. In many cases, the specific reasons for denial were due to a lack of data to determine medical necessity. But in the vast majority of these instances, the insurers didn't provide the specific reasons or data that were missing. So I think specifying what data that are missing that the provider could present to address the denial would also be very, very helpful.